Everyone, thank you for joining me today for our NHS Request Management Portal webinar. My name is Chris Buller and I work for a company called AMS, and today I'm going to be taking you through a demo of our NHS Request Management Portal. And although we see it being used throughout multiple departments and processes within the NHS, there's really a strong focus on subject access requests, access to health records, of course, Medico-Legal, freedom of information requests, and more recently, PACS and Radiology, and occasionally HR, amongst others. So just a brief introduction for those of you who don't know us being AMS. We've been around since 1992, and for a lot of that time, we've worked very heavily within the NHS. And this has predominantly been around our secure file transfer platform, but of course, more recently, our subject access request or request management portal. Now, between the platforms, we have over 100 NHS sites using them, and that equates to approximately 20,000 people plus using the platforms to send and receive sensitive files or health records on a monthly basis. As you would expect, with a company like ours working in the healthcare sector, there's a lot of emphasis on security here at AMS as well. So we have ISO 27001, Cyber Essentials, and the DSP Toolkit. For those of you who do work in procurement, who are open to procuring a solution like this, it may be useful to know that we're also on the CCS G-Cloud framework. So just a tiny bit of background before I kick off the demo. The Request Management Portal, or previously known as Subject Access Request Portal, really came off the back of our secure file transfer platform, where NHS trusts were coming to us using the platform, but wanted us to try and cater for the whole process. So we worked with the NHS very heavily to develop a portal that enabled them to capture the request coming into the trust, allow them to manage the request internally and externally from one portal, and then of course securely transfer the files at the end of the process as well. And this could be of course to patients, but also government departments and the police, DWP for example, coroners, other hospitals, HR as I mentioned earlier, and really any other relevant third party that you may deal with a request coming into the trust can be used, or the system can be used to liaise with them and transfer those parties' secure or sensitive files. So that's probably enough of an intro. I'm going to change screens quickly and take you through the demo. So bear me 1 second. Okay, and let's just make sure that's spotlighted. Great, so hopefully you can see an NHS demo logo in the top left of the screen now. So down here, I've got two different screens. I've got a light colored Chrome window, and in this case, this is going to be the requester putting in a request to the trust. So of course, this could be a patient, but it could also be a solicitor, it could be the police, it could be a government department. Again, anyone you can see putting a request into the trust. So that's a light window. And I've also got a dark window. And in this case, and for the sake of the demo, we're going to see that the dark window is the NHS trust themselves. So it could be staff members processing these requests coming in. Now, the first thing we're going to do is quickly log in as the trust, just to give you a good overview of the look and feel of the portal. And then we'll go through and process requests coming into the trust and just show you the story behind that request coming in and how you can manage that internally. So let's first go ahead and log in as the trust. Just find the right password. Okay, so the first thing you'll notice when you log into the trust is that there's a bit of a dashboard of what's going on with the requests that have come in. So I can see that my requests, for example, are here. Perhaps I'm part of a team, or perhaps I'm managing a team. I can see all active requests, so requests that I have permission to look at or work on, and also pull requests. So this is where requests come in and then they're assigned to a colleague or to maybe even to yourself, or maybe to a different department to process that request. Over here, we've got a task module, and we'll go through that in a bit more detail in a few minutes' time. We'll actually take you into a request itself. We've got the ability to upload requests ourselves as well as staff members. Now, of course, the ideal situation behind the request management portal and why the NHS are starting to take this on, or NHS customers are starting to take this on, is that they're looking to try and digitize this process as much as possible. But we know in reality that's not always the case, and occasionally you're going to have particular people that you deal with that won't want to use this. But of course, you can upload requests manually as well. And these forms can capture any bit of information that you want. This is a very, very simple one, of course, but if you do need to upload a request yourself, it's very easy to do. And of course, we can design the forms with you to do that. Now, you may ask the question, why would I want to put a manual request or a standard request into this platform? But the idea being is that if you are able to capture all the automated requests coming in and also any manual requests you have to upload, is that you have all the information in the same place. So when it comes to reporting or when it comes to audit trail, it's all in one place, and that will be a lot clearer as I take you through the demo. As I mentioned earlier, I can look at my own requests, of course, that I'm working on. And again, active requests. It gives you this nice list, and of course I can filter these and search them when I need to. Pull requests where requests come to actually be assigned or triaged. And you've also got the ability here to look at a request archive. So maybe after a request has been completed or maybe even rejected, it can go into the request archive, and you've got request all as well. So this will show you all live requests, but also all archive requests. Now, just something to bear in mind that these are permissions based, so you don't have to worry about every single staff member that has access to this portal being able to see old requests, for example, or go in and do anything with them. These are all permissions based. But if we leave the NHS side of the portal for now and just quickly look at processing a request into the trust and how that can work and then how it can be managed back with the team. So I'll jump to my light Chrome window now. Now, our demo site, of course, is reasonably bland and reasonably basic, but the idea being that you publish a link on your website, and anyone looking to put in a request to the trust, whether it's a subject access request, whether it's a freedom of information request, for example, they would be pointed to your own personal private portal. And to give you an example, this is Notts Healthcare, for example. And you can see this link here. They will be pushing anyone looking to put a request into the trust to this link. And of course, once they're here, they can then look to access either their own account or put in their request as a guest. But let's go to our demo version, and let's just close Notts Healthcare for now. So here's your published NHS page where maybe a patient or solicitor or government department has access to. And they can log in if they have an account. If not, they can create one. And as I've just mentioned, they can also continue as a guest. Now, most of the NHS trusts that we're working with are really trying to encourage their requesters to have an account. And they're doing that because it means that they're able to use the portal with all the functionality, so they can then communicate through the portal back and forth with the requester. And of course, then they have a full audit trail of what's going on with that request as well. So for the sake of the demo, we'll log in, we'll say that this requester has an account. Let's just do this. And quickly log in. And the first thing it does, it takes me to a bit of a splash screen. and enables me to do a few different things. So, and one thing just to quickly point out while I'm here is that throughout the whole portal, you'll see that there's a blue bar, and this typically tells the user what to do at all times, whether it's a staff member or whether it's a requester. Now, if I'm working on lots of requests with the trust, I'm coming to manage requests, and I can see what's going on, I can see what's being completed, what's active, for example. I can also do things like change my password over here in the profile if I want to, but most of the time, people are going to be clicking on this new request button. And this will take them to the request page. Now, depending on the trust that we're working with, and depending on your particular processes or requests you have in mind, you may have a multitude of forms, you may have one or two, and it varies massively depending on who we're working with. So don't worry about what you're seeing here. These will obviously be bespoke to your particular trust or organization. For the sake of the demo, if I just click on application for your own health records, and it brings me up with a web form. Now again, don't worry too much about the look and feel here. This will be bespoke to your particular trust or organization. This is purely a demo form. So I can come in here as the requester in this case and start to complete this form. So my requester, if we just say he's a patient for now, it's called Chris Demo. Okay. And you'll see some of these red asterisks. That means in this form, they are mandatory fields. And of course, you don't have to have fields that are mandatory, but you may choose to have a few if you want to. And the good thing about this is it really starts to control the information that you receive when someone puts a request into the organization, hopefully making your job easier further down the line. And if I try to submit this form without, and I'll give it a go now, without actually containing or completing, sorry, the information, it should come up with a warning and not let me do that. So again, it's just a nice way of being able to control the information that you actually receive when processing these requests. Okay. As you would expect, this is compatible with smartphones and tablets as well. Okay, if I just continue. This particular form is just asking me for a bit more information about what I'm looking to gather. But again, we would look at what you're currently doing and we'd try and mirror that in a web form and hopefully try and make it a little bit more streamlined as well for you. This particular form is asking me for a bit of ID as well. So in this case, it's asking me for a driving license. And some sort of proof of address. We use a utility bill. Hit continue. I have to agree to some T's and C's and submit that. Now that's really done from the requester's point of view. Of course, I can hit finish. I can go back and do another one if I want to, manage other requests, for example. But if we look at it from the trust side now, what's happening in the background is that the system's going to pick up that request and, of course, send you an email saying, hi, team, there's a new request in from patient name or Chris Demo, whoever it may be. Please log in here to process it. But for the sake of the demo, we're just going to come into the pull request, which is where we know it's going to be. Okay, and here's my request here. So I can come in here now, and this blue line is telling me what to do. So the first thing I need to do is actually assign that request, whether it's to myself or to a colleague or to another department. So I can see a few bits and pieces here. I can see it's been given a reference number, and of course, this would typically match your current referencing. I can see the requester's name or the patient's name. I can see it's automatically being assigned a category as well. And perhaps I'm happy with that, or perhaps I want to change that. I can do that by creating categories within the platform. But we'll just say that we're happy for that for now. I can see, of course, it's active. I can also see that we've picked up potential duplicates as well. So we can look at different information or different data, that we capture from these forms and decipher whether we think it may be a duplicate. So it may be, for example, someone's surname and date of birth. And of course, as a trust user, I can come in here, look at the duplicates and then decipher whether I think it is a duplicate or no, I'm happy to start processing this request. Again, I can come down here, I can look through some of this information if I want to, but for the sake of the demo, we're just going to assign this now, and I'm going to assign it to myself. Now, the next thing it's telling me to do is check the ID, because this particular form has an ID check built in. Now, you'll notice down here the clock hasn't started ticking yet for this particular request. And that's because with this particular request, we've set a rule that the clock won't start ticking until we check the ID. Now, that doesn't have to be the case. It might be that you want the clock to start ticking straight away once the request comes into the platform. It might be that you want the clock to start ticking when you start it. Completely up to you. So now, you may have remembered from the form that was completed by the requester, they've uploaded some files. And any file that's uploaded via a web form, or any file that I go and gather as a staff member, or any file an internal colleague sends me, will end up in what we call the file vault. Now, I can come in here, of course, and I can view these files that are uploaded. And if I'm happy with the driving license, for example, okay, that's great. So let's close that one. Now, it may be that I look at the proof of address in this case, and maybe it's out of date or something, or maybe I'm just not happy with it. So before I do anything else, before I start the clock, I can actually go back to the requester via the external message tab. And I can actually ask them to send me some more proof of address. Now you'll notice when I select the message type up here, and this is going again externally back to the requester, the only thing I can do is actually request more information or reject the response. So I can't answer the response or complete the response in any way. And that's because we've set the rules for this particular form type that, well, I need to do an ID check before I can answer the response, and two, I need to actually go through the checklist that I've created. Again, all these are purely options. It might be that for your particular request type, you don't need to do that. So let's go back to requester and request more information. If you find yourself asking the same question all the time as well, you can have built-in templates in the background. Ours are, of course, very, very simple because it's a demo. But this has just gone, hi, patient name we picked up from the form. Please, can you send me an updated utility bill? And we'll allow files to be sent back to us as well and send that off. So while we're waiting for the patient to get the email from the platform, that's obviously automatically going to be sent, I can come into this external message that I've sent and I could track it, so I can see whether they've actually come back to me or read it. I could also send a reminder. So if I was trying to nudge something through, I could keep sending reminders from the platform, and I could also recall it as well. So if I had actually made a mistake, I could recall that message, and when they go to actually access it, it won't be available. So we should have an email now that the system sent, and I'll just quickly drag this onto the screen, so hopefully you can see that. Okay. And again, don't worry too much about look and feel of this email going back out to the requester. This will be bespoke to your organization. A question concerning a request you have made requires your attention. Please log into the portal and answer the question. So I'm now the requester again, and you should see the screen. And we'll just drag this across as well. Again, this blue bar was telling me what to do. and here's my question. So I need a new utility bill to send back to the trust. And again, all compatible with mobiles and tablets, so they can take a photo of something if they need to. And I can attach my new utility bill, and that, of course, is going back to the trust. Hit send. Okay, so let's just get rid of this for now. Let's just get rid of this email. So, of course, in the background, you get an email to say, hi, team, Chris Demo has answered your question, but for the sake of the demo, we'll just quickly refresh this, and you can see it's being replied to. Now, of course, I could open it from here if I want to, but it's going to end up in my file vault anyway, down here. And if I want to get rid of the old one, I can get rid of the old utility bill if I want to. And as you would expect, everything is caught in the audit trail anyway. So the fact I'm deleting files, I can't go around and hide anything or anything like that. Everything is caught in the audit trail while I'm processing this request. But if I'm happy with the ID, I can go into confirm the ID and I can type in yes. And you should see the clock has now started. I could stop this clock at any time, of course. And again, that's caught in the audit trail, and restart it once I'm happy. Maybe I'm waiting on the requester again, for example, and I need to stop the clock. But now we can go ahead and start to actually build the answer to this request. Now check the ID. So we can go back to request, just check these details are okay. I can edit these, of course. I can change these custom fields to anything that I need to. I can look at the form itself. And I can go through a checklist. Now, again, these are all options, so you don't have to have a checklist, and you can allow staff members to be able to create their own checklist items as well. Now, the great thing about checklists is that if you want them to, they can have validation behind them, which means you cannot actually answer the request until, as a staff member, you've gone through it, gone and go, yep, okay, I've done this, I've done this, I've done this, for example, so whatever they may be. Now, that's great because it just gives you a bit of a safety net. You can make sure that you've definitely done your job and definitely done everything you need to do before you can physically transfer the files securely to the requester. So it's something that's very popular. So I can go through, I can add things to the checklist, I can do what I need to do, I can check them off as I go through and start to answer this request. I can also, of course, go and browse to other files. Anything that I need to actually answer this request and transfer back to the requester. Now, this is something that's reasonably new, and it's something that was commissioned by another trust, and something that we're quite excited about, and something that's been very popular with NHS trusts that we've shown so far. And it's almost a task module or to-do list or to-do module. So if I just quickly show you how this works. So if I click, let's hit add new now, and we just say from, okay, of course I can add a description if I want to. We'll try and keep this as streamlined as we can because it's a demo and it's a webinar. But if I just make a start date, okay, and save that as a task. Now, the great thing about this view is that I can come in here and I can drag it around. So I can say, well, actually, now I've started it, it's now in progress, for example. But to add to that, if I come in here and say, well, I also want to add a checklist for this particular task item, I can do this. I can say, and I appreciate these are very basic compared to what you'd be doing on a daily basis, but just to give you an idea of the concept. Okay. Let's just do one more. Okay. And I can start to check these off. And the good thing about this is if I do this quickly, see that this task is now 67% complete. Now, if of course I can drag this around to anything I need to, but if I go to a table view, I can start to see that this has got a nice little graph or this little pie chart showing me how much is complete. So I can do things, I can assign it to another team member if I need to, very quickly and easily, which is quite nice. I can change the priority if I want to. Say, well, actually, this is high or urgent. You should see the colour of the flag change. I can, of course, change the end date and so on if I need to, as well as add to the checklist and so on. But if I actually come up here and click on this task button here, the good thing about this option is it will show me the task, and I can toggle off my team's work as well. So if I'm part of a bigger team, I can have a look at all of the tasks associated to my team and to myself, and I can play around with things like the priority. I can, of course, assign this to a colleague if I need to. So it's a great way of being able to manage all of the tasks associated to all of the requests in the platform for you and your team. So just thought it was worth quickly showing you that. But let me quickly go back to the actual request that we're working on now. Okay, here we go. And let's look at some of these other modules that we can work on and start to build the answer to this request. So we've covered checklists, of course, that I can have with validation, the background. I can create tasks if I need to for me and the team. I can go off and browse to other files if I need to. And more recently, we've got integration with PACS systems or radiology or DICOM systems. And this is something that's very powerful. And we've had PACS integration with previous solutions such as the AMS secure file transfer. But the great thing about the Request Management Portal PACS integration is that we've got what we call an inline viewer, which makes it very nice and easy for patients or third parties who won't necessarily work in the healthcare sector, won't necessarily have a PACS viewer themselves, to be able to view their PACS images inline, actually within the portal itself. So if I come in here, and let's just get one going while we go through some of the other bits and pieces. So I'll come in here, I can search by patient ID or patient name, and let's just do this, and let's search on this patient name. It should give us a few options. Here we go, and select that. So we'll just let that upload in the background. And what I'm doing there, I'm querying the PACS server to retrieve those studies and those images back so I can actually transfer them back out to the requester, and I can view them myself as a staff member as well within the inline viewer. So while we're waiting for that to go through, it might be that we also need to send an internal message with colleagues. Now, just a quick, I suppose, disclaimer on the internal messages is that some organizations we speak to love this concept and some don't want to use it. But the great thing about it is that it can be extremely simple for clinicians or other colleagues to be able to provide you with the files that you need when doing your job in answering the request without having the password. And that's because we use a unique token. Now, let me just start the process and I'll show you what this means. So if I come in here, and perhaps I'm working in the Access to Health team or in the Subject Access Request team or HR, whoever it may be, but I need to request files from a colleague. So I come in here and I can say that my colleague is called Chris Demo 1, and perhaps he's a clinician in this case. And I'm going to request information. And again, if I find myself asking the same question all the time, I can have templates in the background that I can pick from whenever I need them. Of course, I can edit these if I need to. Just makes life a bit easier if you find yourself asking the same things all the time. And I can say allow files to be included. I can also send them files if I want to as well. if I want them to see something before responding to it. So let's just send that off, like so. And we'll wait for the email to come through for the clinician. But while we're doing that, as we could do with the patient, of course, I can do things like track it. I can send a reminder. Once I could recall it, I could create a task saying, chase up Chris Demo 1 for a response for the files. But we should have an email any second. And here we go. Okay, and here it is. We'll just drop this onto the main screen, so hopefully you can see that. I'll just double check. Okay, great. So, so as the clinician in this case, I can then access the message that the team have sent me, that the Access to Health team has sent me. Here we go. So I clicked on that, and it's asking me to request a token. So again, I don't have to remember a new password or anything like that. Now, if you don't want your colleagues or clinicians or medical colleagues to use this, you can also still cater for that via the notes field and dragging and dropping emails, for example, giving consent or consent forms into your file vault. So whatever happens, you're still building up that audit trail and proof of everything you need to do when answering these requests. If I go back, and hopefully we should have a secure token here, which we do. And here we go. I can copy this token, paste it in the box, and validate it. And there we go. I can go to the message that the team have sent me, and I can say, and of course, I can browse to my files and send them back to the team. We'll just call that audit. Okay. Reply back. Like so. So don't have to remember a new password. It's very easy for them. And it enables you to, again, keep everything within the portal where you have the task module, you have the audit trail, and you know exactly what's going on with that particular request at that time. So let's just come out of here. Let's get rid of those. Of course, in the background, again, you're going to get an email come through to say that a colleague has answered your question, but for the sake of the demo, we'll just refresh this. There we go. I can see it's been replied to, and again, I can open it here or just go into my file vault anyway, and it's going to be in here. Just quickly, while we're in the file vault, it's worth pointing out that we can tag files as well. So if you're, for example, collecting files that you don't necessarily want to be sent back out to the requester, you can tag them with confidential, for example, and that means when you actually come to select the files at the end to transfer back to the requester, they won't be available. So again, it's just a little bit of a safety net there to stop you transferring data that shouldn't be leaving the trust. So let's go back to our DICOM and quickly show you this. So this is uploaded, and I can open this. And what we've got here, and again, it looks reasonably simple, but it's something we're very excited about, because for patients or solicitors or whoever it may be outside of the medical profession that don't have a DICOM viewer themselves can view these images in line. So if I come here, and this is again all mobile and tablet compatible, if I come in here, you should be able to see hopefully the image move, which is great. We've got things like opacity on and off. We can turn the information layer on and off, for example, and reset it. If we want to as well, we can download individual frames, because we know that people may want that in a PNG file format, for example. So again, a very simple viewer, but something that's very, very popular at the moment, because it allows the trust that we're working with to stop burning to disk. The staff can query the PAC server straight from the portal and then transfer these files in a format that's very easy for people to access and use. We know a lot of trusts traditionally burn to disk for this process, but I think everyone understands that the availability of disc players or CD players within laptops and devices is becoming less common. So they need to find another way of being able to provide access to these files and these images, and they're looking at the portal and the SAR portal as a way of doing that. So let's just get rid of that. So of course, I'm starting to build the answers to my request now. Again, I can go through, I can add more checklist items if I want to, I can create more tasks if I want to, I can go and access more files if I want to by browsing to them or dragging and dropping. I can go back off to the requester and ask for more information if I need to. I can go back off internally if I need to and ask for more information from my colleagues. But once I'm happy with everything, I can actually start to build the answer to this request. And I do that by going back to the external message because we're going back to the requester. And I will click new. Now you should see now that because I've done what I need to do as a staff member, I've checked the ID, I've gone through and I've gone through my checklist, that I can now complete the response. So of course I can send them a message, I can do a partial response, I can completely finish the request and answer it. And again, I can go back and request more information or reject it if I need to at this stage. But it just gives me more options. So if I go ahead and just complete this response, and again, if you've got a nice template that you use, maybe it's a letter or an email at the moment, we can pick that up and use it in the background. And it'd probably be more thorough than, of course, our demo one, but hide patient name and whatever you want to say. Again, I can attach the files that I need to, whether they're the DICOM studies or whether they're documents, and I can pick for them individually or just select all of them like so. And once I'm happy, securely transfer those files to the requester. So, and I appreciate that's a very, very simple version of what your teams will do on a daily basis, but hopefully that gives you an idea about the portal from a user's perspective. What we're enabling you to do is capture the request, whether that's via a web form that's come in, or whether you're doing it via a manual upload form, manage it through with you and your team, going back to the requester via external messages, going off internally via internal messages, creating tasks and assigning them to yourself and to colleagues and prioritizing them, helping you manage this request, and of course, securely transferring that request at the end with an audit trail. So here's the audit trail so far. And of course, I can download this audit trail whenever I need to. So again, I appreciate that's a very simple version of what you may do on a daily basis, but hopefully that gives you a good idea of the toing and froing, what the portal is designed to do. Now, just one thing to quickly touch on before we finish the webinar, because it's quite a big driver for organizations looking at this with us, is the reporting function. So there's a lot in this admin side, so don't worry, I'm not going to go through all of it today, but you can have different groups, for example, if you wanted to separate requests completely. You can create your own forms and design and branding, but we're just going to click on reports and go to request report. And if we just push this back a few months, just so we've got some data in there. Like so, and what we're saying here is that this is for all requests, so whether they're completed, whether they're outstanding or breached, compliant or rejected, and we're going to say for all users. Of course, I could narrow this down as well if I want to, and hit search. So we can see here, for example, request categories, that we see there's been 56 patient requests during this time frame. There's been some high court, there's been an FOI from my colleague Neil, for example. There's been some FOIs from myself. Now, hopefully you get the idea, and don't worry too much about these categories. It's purely a demo system. These, of course, will be your own categories. So whether it's patient, police, court, DWP, whatever it may be. I can then go, well, let's look at the forms as well. Okay, you see most of them being applications for your own health records. There's been some FOIs in there, some tests from my colleague Damien, for example, and some FOIs from myself. Now, everything you see presented in these graphs is shown below in these columns as well. And of course, you can download this to CSV if you need to manipulate that data. Status, so you can look at active versus completed versus rejected, for example. This is quite handy if you are managing a team. So who's actually taking charge of what during those dates. So we can see, for example, I've got 33 in there. Colleague Damien has 1 in there. Some haven't been assigned, for example. Again, it's a demo system, so it's some sort of strange stats in here, but I hope you get an idea. You can see what the team are processing during that time. And of course, this will change depending on the criteria you set here on the left as well. So trends are quite a nice way of looking at things. So for example, you can see patients were very high back in November, took a bit of a drop in January, up again in February, then dropped off again in April. So you can sort of see where these trends are heading. Again, great for proactive management of a team or a process, and the same with the forms, of course. And of course, active versus completed. So if you can see that your completed trend is going upwards and your active one's going down, you know the team have been really efficient and they're starting to process these requests much quicker. And this is quite a handy one if you are managing a team, where you can see, for example, we take me as an example. We can say in November, it started to increase and dropped off and had a big spike in February. Maybe towards March, I got a bit lazy and it dropped off quite a bit. And then back to April, it's coming back up. So again, if you are managing a team, quite a useful tool. And just to add to that, we've also got custom columns that we can drag through to reports. So anything we can pick up from a form or anything that we can pick up from the system itself that we can capture, we can report on for you. So if we just took hospital site as an example, and let's just close that off and hit search, we should see down here now that I can search on hospital sites. And if I start to type in Broomfield, we should see that all of the Broomfield requests that link to that site that also match the criteria at the top are presented here. And of course, I can download that. So hopefully you can see how granular you can become and be with this reporting just from the data that we can capture from the request forms coming in and the data we can capture from the system generally. So that concludes the demo. I do appreciate your time and hopefully you have found that useful. So I'll just pull up my summary slide now, like so. So thanks again for your time. If you do want to get in contact, please don't hesitate to get in contact with us. There are some contact details up on the screen right now. If you do have an account manager already, obviously please feel free to reach out. And yeah, thanks again for your time and hopefully we'll see you on the next one.